Namaste, good morning, good afternoon, good evening, as per your time zone, all the learned global citizens having interest in Ayurveda. Yes, in this series of my YouTube channel message to you all, the global stakeholders of Ayurveda, I have just covered that in your country, how you can find a good qualified Ayurvedic physician. And the second session was, if you are coming to the India, once again welcome to you, then which Indian center one should prefer for the Ayurvedic interventions. Today, the third in the series of the Brush the Bushes Beyond the Boundaries, and I wish to address the particular reasons, very specific reasons, and invite your attention to address all that. Yes, of course, I want your contribution. I request for your efforts to make it clear the waves for the recognition of the Ayurveda, the obstacle being produced by the many organizations, many professionals having conflict of interest with the Ayurveda. This conflict of interest is not only the recognition, but it's in greater respect on the larger canvas. It is the commercial. They are having some commercial conflict of interest. Their business are being affected in the down way when any alternative system of the medicine of the world got acceptance. Who are those? We will talk about this. But before that, just I am raising one question before you all. By doing this, are the regulators of your respective country or any organization of your respective country, if they are talking against a well-established system of medicine since thousands of years in its origin country, like Ayurveda, which is being practiced here since last thousand years, and having all kinds of the requirement which a medical system should have, and all the parameters for a medical system right from the dawn of the civilization of the Indian subcontinent. We have all the physiology of Ayurveda, we have the anatomical descriptions of Ayurveda, which are at par to the modern days nowadays also, but the concept of the writing was something different, the way of the description is something different, even the numbers are different, because all those things were depending on that day's available way of the learning and the teaching. We have separate chapters of our diagnosis in our book of Charak Samhita, Susut Samhita, or the Ashtanga Hridaya. We have separate chapters of the medicine for the treatment and the many more. What a system of medicine should have, we all have since thousands of years. So, what is the lacuna? Why people are not taking it as a system of medicine? Yes, I'm coming on that point. In the colonial India, when not only the Britishers from some other countries of the Europe, like France, like particularly Denmark, when they visited India in some different way, but mainly it was the East India Company, the Britishers, they have a mindset that we are the superior. Don't take it otherwise, but it was the mindset. And many people of the Europe also now agree with this particular mindset when back 200 years, back 1000 years I can say, if people are thinking that they are the superior with the other races of the globe. And when they found here that here is a well-developed system of the medicine, they denied it. With the reason, a particular mindset that what we are having developed in our respective country as a system of medicine is superior to the system of medicine prevailing in Ayurveda. Just one submission before you. When these different cultures of the different people came to India with a system of medicine which was at that time at the same level what was the Ayurveda. This is the science and technology which develops the modern day allopathic, and I congratulate you for this. And here our lacuna, that we can't run Ayurveda at the same parameters and on the same application of the technology in this system since last 300 years. Otherwise, we are also having the same wavelength and the same development. What is the development in the allopathy? So when they saw these things and they are having this opinion, no, this system of medicine is not good and cannot be equated with our system of medicine, what we are carrying out, and nowadays it is the allopathy. Fine, every system is good, and of course, if this is the mindset of every citizen of every country, that what I have, that is the good, what I have, that is the best, and everyone, I'm not blaming anyone. It is a human mindset. Fine. So they discarded Ayurveda. But Ayurveda has its potency. It is being practiced into the India since thousands of years. Now I don't want to address other questions. What people raise in the discussion, the rate of mortality, rate of the healthy people, the rate of the all other medical criteria of this Ayurvedic system of medicine and allopathic system of medicine, really it is the debatable. And of course, if we equate all these things in the month of June 2023, there is a lot of contributions from the European medical science or the American this Western system of medicine, allopathy, in the improvement of the life, in the improvement of the all surgical procedures, in improvement of the new drugs for the treatment of a lot of dreaded diseases. Really, we appreciate it. We congratulate you for the development of this by applying the core science and the biomedical science. No doubt about it. But here in the Ayurveda system of medicine, we have something unique. And that is the what? That is our comprehensive approach, addressing the mental peace, addressing the mental health. We are not only treating the physic, but we are treating psyche also. We are having a system of the family promotion and peaceful and harmonious society. That is the unique part under a medical system. Under a medical system, not the philosophy. But this medical system has this unique philosophy. That is the idea. Fine. With these words, just one thing I am raising before you all. See, the developed world has given to the human in equal amount the level of the stress, the rat race, and the disintegration of the families, and many unilateral approach which is not good for the human being. So every human of the globe nowadays having one concept in his or her mind, that okay, everything is fine, all facilities I have, all the materialistic life I'm living, I'm good with the financial or rich or the many thing more. We are rich with the technology, fine. But where is the mental peace? Where is the happiness? Where is the wellness? And where is the index for a well-being, settled life? In this case, Ayurveda is one answer before the world. And due to this reason only, our respected, learned, dear citizens at the globe, all across country, you need Ayurveda. You deserve Ayurveda. Yes, I repeat, you need Ayurveda. You deserve Ayurveda in your own country for your own benefit. Yes, this is my humble submission. Now think the other things. Why the regulators of your country, why the government and the other personnels having a conflict of interest with the business of the health sector are denying services of Ayurveda to you? Yes, I am indicating that to you, not the whole insurance system or the whole corporate sector. No, no, to you. What is the harm if you have a good things of Ayurveda for you in your country, for your family in your country? Why you are not trying for it? You should. You should be benefited with the all physical and psychological, spiritual, holistic, comprehensive way of the Ayurveda for a human being, for a very good way of the life, leading to the happiness and the wellness, and promoting the health, of course preventing the diseases. So why you don't deserve for this? And why governments are barrier? Why those organizations are barrier which are not recognizing Ayurveda? Yes, Ayurveda need a lot of things. Ayurvedic medicines need validation. Ayurvedic education system in your country or even in India needs some good reforms, and we are doing all these things with our full efforts. The NCISM has just notified in the last month a new set of the regulations for the postgraduate courses. The last year they have notified the undergraduate courses, which are making the BMS graduate at par to any medical system, and they may be the global Ayurvedic physicians on the virtue of the syllabi given to them. And same way on the virtue of what the PG syllabus produced by notified by the NCISM, National Council for the Indian System of Medicine, the one and the only one regulatory system for the Ayurvedic education and the practices in India governed by the Ministry of Ayush, Government of India. Thus, the regulator, like the US, have the educators in the field of education. So here is the need. You should own, for your own benefit, promote Ayurveda. This is my humble request to you all. Yes, I must share with you where are the obstacles, and with my full integrity and honesty, I may say the obstacles are the only business oriented. The conflict of interest is the dollar, the share in the market. Yes, believe it. Whenever any giant of the MNC in the nature having total business module more than any state governments of India, annual budget of the many state governments of India, the own company of allopathy, when they are looking to their business, they want growth. See the vaccine business and some rumors and some things more for the imprisonment of the CEOs or the scientists who just played, and the many books what the pharmas are doing in this line to make money. And see all the old stories, I am keeping all that aside. So when their business interest is getting affected even a decimal of the percentage, they start targeting all traditional systems of the world, and specifically the Ayurveda. And how they target? They target just in the form of some scientific studies, publications. And those publications are, yes, many people in the West are speaking, many good people are, honest people are speaking that these drug mafia, yes, I can use this word, this drug mafia is behind the publications of all so-called research papers which are withdrawn later, and editorials are coming in the very top index, having very high impact factor journals. I shall not take name of any organization or any journal, But the leading journals of the medical science, leading journals of the core science, the leading universities, and a professor is publishing a paper, oh, these Ayurvedic medicines are very harmful, these are toxic to the human, this should not be given. There is a 2 deaths reported in this particular city, and this is due to the lead poisoning. Why not, gentlemen? You are talking about the 20,000 deaths happening annually, more than that, due to the side effects of modern medicine. Why you are not talking about all the interactions being take place about these molecules which are not understandable completely, and the physicians are prescribing and they are doing its own effect in the human body. I can say this is the third after the cancer and the heart disorders that people are dying due to the side effect and the adverse effects of the molecules of the modern medicine. But there is no discussion on that. But if 2 deaths are taking place due to any Ayurvedic interventions, there is a radios program, there is a TV channels program, there is on the public whole the system of the print media. Yes, I remember 2008 August, the report of a scientist from the Boston University published in the JAMA, and it was published in the India from a vernacular language paper to the national papers, and the next day government of Canada banned the Ayurvedic medicine in the country. They cancelled the import assignments. So this is the business model which is dividing you, the learned citizen, who want Ayurveda for their own benefit. So we have to collectively answer these people. They will not allow to grow Ayurveda as a natural system of the medicine wherever their interest is being compromised. So in this session, I request you be aware about it, and be aware about the conspiracies, theories of these organizations and the corporates. Be aware about the regulators who are having some conflict of interest with these pharma companies and checking the propagation of any good natural system of medicines. PM, like Ayurveda in your own country. We have our limitations, I accept. But why the whole of all resources of your country should not be used for your better health through the Ayurveda? Don't you deserve it? You deserve it. Then why you are not going to the court of your respective country? I request for the giving you a right and approach to have Ayurveda as your choice of medicine in your country. You should do it. Then only these conspirators will get elation. How much government of India may fight, or how much the Ministry of Ayush, or how much any other who is knowing Ayurveda, and many of the people who are coming from the developed countries to the India, they are having a good faith in Ayurveda. They are affording it. But any normal citizen in your right country are capable to visit India frequently for the treatment, for Ayurvedic treatment. So why not Ayurveda is in your country, available to in your insurance system, available, it may be economically available to your last man of your country. It should be. And Ayurveda deserves it on the virtue of its doctrine, philosophy, and the addressing the human as a complete human with caring all its emotional as well as physical, all the disease, eradication of the diseases, and good spiritual health, the peaceful and the harmonious life, individual. Of course, they at the individual level. Therefore, what is my submission today? That please join hands with your country, all Ayurveda lovers of your country. We are providing you all the documents of the quality, safety and the evidence, and fight a case in your country to have Ayurveda as a system of medicine in your country for the benefit of you. Thank you. Namaste. Good afternoon, good evening, and good morning as per your time zone. Thank you.